Hey everyone, it's Amy Wood with Dr. Cedrek McFadden. He's our 7 News medical consultant. And Dr. C, all of us going through the pandemic and everything else that's been happening, sometimes feel like, mentally we may not be doing as well as maybe we used to. And there's a lot of research out there that talks about diet even having a role in our mental health. So talk a little bit about the health conditions that can be prevented if you actually change your diet.
Well, there's been a lot of observational studies done over the recent years about the influence of a healthy diet and mental health problems, such as depression or anxiety. And these studies have shown that when people consume diets that are high in the good stuff, the fruits, the vegetables, the whole grains, even diets such as the Mediterranean diet, they're less likely to have mental health problems such as depression. One study had a 32% reduced risk of depression just following a really regimented, strict Mediterranean type diet. They've also seen that when people consume diets that are high in saturated fats and sugars, they may have an increased risk of anxiety. And this has been seen in both children and teenagers and older adults. Now, these are our observational studies, which means we can't say it's cause and effect, but we can definitely say that there's a link or an association between the two.
Talk a little bit about how diet and nutrition influence mental health.
Well, that's a really tough one to answer because there's no definitive answer. I tend to think that people who have a healthy diet may already be engaging in behaviors that may improve mental health, such as engaging in regular physical activity or engaging in good sleeping patterns or not smoking. But there's other thoughts and theories that center around those diets that are high in the good stuff and having sort of high antioxidants or high anti-inflammatory type properties into them. And then there's a whole other element that talks about the healthy gut bacteria and how that may increase the number of chemicals in your body, such as serotonin, that may promote a healthier or better mood.
So, if somebody has a mental illness, are there dietary interventions that can be used maybe as a treatment?
Well, there have been, again, some research on this exact topic. There's one study that came out several years ago where they took people who had moderate to severe depression, and they continued to give them the medications that they may have been receiving for the depression. But they put them in two groups. One group received dietary counseling and modifications like with the Mediterranean diet, and the other group received sort of standard counseling that people may already be receiving. Now, what they found is that the people who received the dietary modifications had a significantly greater reduction in their depressive symptoms. Now, this is a short and this is a small study. However, it is encouraging to remind us that there may be some benefit in sort of engaging in these healthier eating behaviors.
And you've talked about like the whole grains, the fruits, the vegetables, eating the right things. But what about dietary supplements? We hear a lot about those. Are they of use in this kind of scenario?
Well, dietary supplements are definitely big money right now, big business. We know that diets that are low in minerals such as magnesium or low in folate, iron, vitamin B6, vitamin B12, even vitamin D, those diets that are low in those have a higher risk of having mood disorders, anxiety, and other mental health problems. Now, this is not to say that we should all load up on these supplements, but it does say that if we can kind of eat the colors of the rainbow, eat the things that are good for us, we may be in a better mental health place.
And so, what's the bottom line takeaway when it comes to this topic, mental illness and the ability to use your diet to influence it?
Well, mental health is a very complex issue, and no one should ever be making unilateral decisions about their mental health, especially if you've been on medication. Always talk with your doctor before making any changes, but we should all take this as a sign of encouragement that we should be doing the right thing, not just for our physical health, but also for our mental health.
Dr. Cedrek McFadden, thank you.
Thank you.